Hi Beaty family, in honor of National Sunscreen Day, I wanted to take a moment to go over the SPF/sunscreen that we offer here at Beaty Facial Plastic Surgery. A few questions that I've gotten, and I want to cover those before we even start. What is the difference between UVA and UVB? So UVA rays are rays that go deeper into your skin, cause more aging. UVB are rays that cause more burn. So SPFs will cover both. When do we apply? Well, before you go out in the sun. For all of my people that were working on anti-aging, whether that be filler, Botox, skincare, you should wear SPF every day. Apply it first thing in the morning. When you're out in the sun at the beach, I would apply every 2 hours just to make sure that you've got full coverage. I personally myself, when I'm at the beach, I apply both a physical and a chemical barrier. What's the difference? Well, I'm glad you asked. So a physical barrier is a SPF that has an actual chemical in it that reflects the UVA, UVB rays off, okay? A chemical barrier is an SPF that the chemical in the sunscreen will absorb into your skin. It will take the UVA, UVB, convert it into essentially heat. So we offer the Elta MD line here at Beaty Facial Plastic Surgery, and we have 4 types. So there really isn't a whole huge difference with them aside from 2 are physical, 2 are chemical. We have 1 that's not tinted of each and 1 that's tinted of each. So essentially not a whole lot of difference. So the first one is a chemical barrier. It is 50 SPF. Again, a chemical barrier is one that absorbs into your skin. It will take about 15 to 20 minutes to absorb fully. These are really good for our sports players. We want that chemical to absorb in really nicely. That way, when they do go out in the sun, it will absorb it and then turn it into heat. This one is not tinted. Then we've got the other chemical barrier. This one is tinted. The SPF is 46. Personally, myself, I do the tinted and the not tinted. What I'll do is, and I'll show you in just a minute, I use the physical barrier that is not tinted, and then I will use the chemical barrier that is tinted, especially for my face. For my body, I use a physical barrier that is not tinted because I don't want my body to be tinted, okay? So both of these, again, are chemical SPFs. These are the ones that will absorb the UVA, UVB, and convert it into heat. Now on to the physical barriers. This is a tinted physical barrier, SPF of 41. Again, physical is the SPF that actually bounces those rays off of your skin, okay? Again, physical barrier, SPF 41. This one is tinted, okay? Then you've got the other one that is not tinted, SPF 47. So a few months ago when I went to Cancun, I used this full body and then this on my face. Then I applied the chemical tinted on my face. And I came back with absolutely no sun. I mean, maybe a little bit, but not much. So I reapply again every 2 hours when I'm out in the sun. If I'm not going to be in the sun, I apply first thing in the morning. I do not apply at night. Now, research says that we should probably apply at night as well because of the rays coming off of our TVs, the rays coming off of our phones. I don't personally do that, but if someone were to ask me, I would tell you to do it. Anyway, so happy National Sunscreen Day. If you have any questions, by all means, please DM me on It's So Very Gary, or you can DM Beaty Facial Plastic Surgery as well. I'll be more than happy to answer your questions. And if there's ever anything you need, you can DM me on either of those. Talk soon. Love you guys.